Hi, Blaine. Thanks so much for being here.
Hey, Leah, it's great to be here.
Terrific. Well, let's start at the beginning. Tell us a little bit about what Lumiio is.
So Lumiio is a Calgary-based global digital health company that focuses on developing digital tools and real-world data programs to help patient organizations, clinical researchers, and pharma accelerate therapeutic development, essentially.
Amazing. Amazing.
Yeah.
So tell me a little bit about the origin story of this company and how it got off the ground.
Yeah, so it all started with one of our co-founders going back about 6 years ago when Lumiio started. But actually, even before that, when he started, Dr. Lawrence Korngut, who's a clinical neurologist, focuses on neuromuscular diseases. When he first started his clinical career and practicing in the neuromuscular disease space, there's actually over 150 rare types of neuromuscular diseases. So as you can imagine, the nuances between these diseases and understanding how they're presenting was really challenging. So he, along with several other clinicians across the country, started the Canadian Neuromuscular Disease Registry, which grew over the last 15 years to have over 5,000 patients, collecting data from over 150 diseases, and became the gold standard with producing over 200 data releases and publications. And it was through that work and success that other patient organizations and pharma and researchers were saying, hey, can you help us build data programs outside of neuromuscular and outside of Canada? And that was sort of the eureka moment of, yes, let's do that. And Pfizer was our first partner, and that's how we started 6 years ago.
Incredible. Incredible. Now, you're the CEO, so tell me why you wanted to get on board with Lumiio.
Yeah, so it's a long journey for me, and it was primarily through my lived experience of having a son with a rare form of mitochondrial disease and kind of being immersed in this rare disease world. And I've been involved in numerous patient organizations, including sitting on the board of the Canadian the Canadian Organization for Rare Disorders. But one of the underlying themes across most rare diseases is that 80% of rare diseases are genetic. And as you look at the advancement of technology in rare diseases and genetic diseases in particular, new technologies like next-gen DNA sequencing and the data that can be gleaned from that is very, very powerful. And I met Lawrence a couple of years ago, and as he was telling me about the work that he was doing in his practice and within Lumiio, it really was just a natural fit with some of the problems that we're trying to solve in the mitochondrial disease space and other diseases. I'm like, okay, I want to be part of this. So that was really what drew me in.
No kidding. I can see how it would, for sure.
Yeah.
Okay, so from Lumiio's perspective, what sort of impact are they trying to create in the world?
Yeah, so one of the key areas of what we're trying to do is be able to create a platform that can aggregate all of a patient's data. Because right now it's just spread all over the place, and it's I'm sure anybody can relate to this. And especially for complex patients, they're in numerous clinics, and all that data is siloed. So we want to be able to provide that data in a simple, accessible way so that patients really have the data and the tools to own their health journey and make informed decisions. So that's really, really important for us. And also on the technology front, which really excites me and our team, is that with the rapid development of things like wearables, for instance, and other digital tools, there's the opportunity to collect a lot more rich passive data that then we can layer on AI and machine learning algorithms to really look at changes and trends in either someone's health or disease to predict in advance of an episode or things like that. So really it's developing that check engine light for your health that really can help prevent and eliminate diseases from manifesting. So that's super exciting. And then also, like, at the end of the day, my son is 15 years later, there's still no treatment for mitochondrial disease. So it takes over 10 years and over $1 billion to develop a novel therapeutic. But now, we see that opportunity to be able to shorten that time frame. And I want to be bold and say, can we speed that up by a rate of 10 times? And would it be possible, to be able to within a year develop and have a therapy in a patient? So that's bold to think that's possible, but it is. I do think we'll be able to see that in our lifetime.
Wow, Now that is
Yeah.
incredible impact for sure.
Yeah.
No question. It's incredible. Okay, so on this journey, you clearly need a little bit of help every once in a while. Our Funding Catalyst team helped you guys along. Can you just tell me a little bit about what they did for you?
Yeah. It was awesome working with Katie and Malcolm on the team, and yeah, we actually worked together on an application for Prairie Scan, and one of the things that was a bit of a challenge on this one was a tight time frame, and I must say they're so collaborative to work with, and just stepped up, and they just made it really easy for us to be able to essentially provide some basic content, and from there they develop the strategy of how we put the project together and budgeting and all of that, and ultimately we were successful. And as was just announced a few weeks ago, we were one of 15 recipients for Prairie Scan funding, and we just received a word that we're going to be able to access 1.3 million in non-diluted funding over the next 2 years, which is awesome. So
That's
essentially
incredible.
and we were, this helps us achieve our seed funding round, and will help position us for a future Series A. So this is really pivotal for us. So we're grateful for the help that the Catalyst team provided.
Terrific. Blaine, thank you so much for sharing all of this with me. It's going to be an incredible journey.
Yeah, thank you, and appreciate you spreading the word and all the great work you guys are doing at Thin Air Labs as well.
Thanks so much.